My name is Keshvi Vijaria. I am from final year B Physiotherapy and my topic for rubrics 2 is fractures and its complication. Now first of all, what is fracture? Fracture means the break in the continuity of the bone is known as fracture. If the break comes in the continuity of the bone, that is fracture. Now the fracture are classified into 6 different types. First is based on etiology. For etiology there are 3: traumatic, pathological and stress. Traumatic, the fracture caused due to any trauma is known as traumatic fracture. Pathological fracture, if the pathologies are already present in the body, for example osteoarthritis or osteoporosis, that pathology leads to a fracture, that is known as pathological fracture. And the third one is stress fracture. Now stress fracture, if the injury occurs, the repetitive injury occurs into the body part and that leads to the fracture, that is known as stress fracture. The second one is based on relationship with the environment. There are 2: closed and open. Closed means the fracture is inside the body, it doesn't come out. The second one is open, internally open and externally open. Now internally open means the fracture fragments come out of the body from inside, that is known as internally open. Externally open, for example the gunshot injury, that object comes and hit to the body and that leads to the fracture, is known as externally open. Third one is based on pattern. On pattern there are transverse, then oblique, spiral, comminuted and segmental. Then the fourth one is based on complexity. Complexity, there are simple and complex. Now the fifth one, based on the displacement, there are 2: displaced and undisplaced. Undisplaced means it is stable and displaced means the fracture fragments shifted like this, that is displaced. Then the sixth one is based on quantum of force causing the fracture. There are 2: high velocity force and low velocity force. Now the complication of the fracture. The complication occurs in the proportion of the fracture. Now there are 3 types of complication: immediate, early and late. Now for the immediate there are 2: systemic and local. In systemic, the first is hypovolemic shock. Now hypovolemic shock is a life-threatening condition that occurs when there is heavy loss of blood and fluid from the body. Now in local, first is injury to the major vessels. The fractures leads to the injury to the major vessels if it is internally open, externally open or in case of displaced fracture. Now injuries to the muscle and tendon. If the fracture fragment is displaced, it can rupture the muscles or the tendon around the fracture. Now injuries to the viscerals and injuries to the joint. If the fracture is near to the joint, it leads to the joint to be subluxed or dislocated. Now in early also there are 2: systemic and local. Systemic, first is hypovolemic shock. Now the second one is fat embolism. The flat globules are generally originates from the bone marrow or the adipose tissue. Fat embolism occurs in case of the serious injury or in the multiple fractures. Now the third one is deep vein thrombosis and the pulmonary embolism. Deep vein thrombosis, when there is a formation of a blood clot in the deep veins of the body, it is known as deep vein thrombosis. It happens when the part is immobilized for a longer period of time. Generally occurs in lower limbs. Now the fourth one is acute respiratory distress syndrome. Here the perfect mechanism is not known, but it is supposed to be due to the release of inflammatory mediators which disrupt the microvasculature of the pulmonary system. Now the fifth one is septicemia. Now what is septicemia? Septicemia is a blood poisoning. Now the sixth one is crush injury. Crush injury, the massive crushing of the muscles, due to the earthquake or any like conditions. Now in local, first is infection. And infection, if we have fracture or it is externally open, it leads to the infection in the body. Now the second one is compartment syndrome. Now in the limb, a muscle lies in a compartment which is surrounded by bones, fascia and interosseous membrane. Now if there is increase in the pressure in this compartment due to any reason, it jeopardizes the nerve supply to the muscles and the nerves. The thing that leads to it is known as compartment syndrome. Now for late complication there are 2: imperfect union and others. Now in imperfect unions there are delayed union. Delayed union means the fracture they did not get union in a specific period of time. Then the second is non-union. Third is malunion and the fourth one is cross union. Now in others there first is avascular necrosis. If there doesn't adequate blood supply to the part of the body, it leads to the avascular necrosis. The second one is shortening. third one is joint stiffness. The fracture leads to the joint to get stiff. The fourth one is osteomyelitis. It leads due to the infection. Then the osteoarthritis, and the last is ischemic contracture. The contracture can happen in case of fracture. Thank you.